What is grief in one word?
I'd say loss.
Death.
Sorrow. Morbidity.
2.5 million individuals pass away every year in the United States, each leaving an estimate of 5 grieving individuals. This results in roughly 12.5 million people grieving each year solely due to the loss of a loved one. Now think about how many people may be grieving due to a breakup, an injury, an illness, or even financial loss. Despite its relevance, grief remains widely misunderstood, as indicated by the interview of kinesiology students at the University of Toronto. This inspired us to come together today to explore the toughest, universal, yet very personal experience of grief. We will provide a comprehensive understanding of grief, exploring its definition, causes, emotional, physical symptoms, models, theories, and coping mechanisms. Our aim is not to dwell on the pain of grief, but rather to gain an understanding of it so that you can navigate grief or support others grieving. Grief, defined by the textbook, is an emotional response to death, which may take months or years to complete. Grief, defined by the dictionary, is keen mental suffering or distress over affliction or loss, sharp sorrow or painful regret. Despite grief's complex nature, it serves a crucial purpose in the healing process. Understanding grief and knowing you are not alone can make a big difference in the recovery process. Loss of grief can significantly impact the grieving process in terms of how long, how intense, and which way an individual may grieve. These causes can vastly differ, with the most common form coming from the loss of anything that holds significance in your life. The first most common talked about cause is death. How this death occurs can significantly impact the grieving process. If the death is an on-time event whereby it occurs at the expected time for an individual's culture cohort, such as passing away at 90 years old, the grieving process may lead to less depression and prolonged grief, as opposed to deaths that are off-time events, such as passing away at 20 years old. When an individual loses their spouse, the grief tends to be a very tough process, typically resulting in long-term decline in mental health. This is especially the case if the individual has a history of poor mental health, high levels of marital satisfaction, or the individual who is reliant on the spouse's income or pension. Sudden and violent deaths, typically caused by accidents and suicide, significantly increase intense grief, with 36% of widows and widowers experiencing PTSD symptoms from the loss of their spouse. Additionally, death caused by suicide, drugs, and alcohol abuse tend to cause guilt and disenfranchised grief, where an individual may feel as though they don't have the right to grieve, making the grieving process much tougher. Lastly, deaths with intrinsic meaning, such as the death of a soldier who's risked their life to save others, typically give the griever a sense that the death has not been without purpose, allowing an easier grieving process. Another significant factor that contributes to grief is the loss of a close friend. This friendship can be lost due to many reasons, but it is hard to know that the person is alive but not in your life anymore. Serious injury or illness to yourself or a significant other can also result in grief. Individuals who have cared for their spouse during a period of illness prior to the death usually have an easier grieving process to death, as their grief tends to emerge while the spouse is ill. Death is seen as an escape from suffering, which typically relieves grief. Financial loss can also be a form of grief, as money is what the world runs off of and your means of survival. The last most notable form of grief could be losing something with sentimental value. This could be a blanket you carried with you all throughout childhood. While these are the most common causes of grief, it is important to know that grief is very individualized, whereby there are many other forms that can cause feelings of grief. We all tend to grieve in similar ways, with characteristics defined by the textbook as sad facial expressions, crying, loss of appetite, and age-appropriate displays of anger, such as temper tantrums. Some other emotional and physical signs could include the inability to speak, feelings of anxiety, not wanting to be alone, social withdrawal, feeling scared, or the inability to sleep and eat. Most signs are common and are usually what most grieving people of all ages will end up feeling. As hard as you may want to push all of these emotions down, it's important to acknowledge and experience them. Grief can manifest differently across all age groups. Adolescents have a tendency to engage in a what-if mentality and judge the world through idealized images. While this mindset can be great for critical thinking, it can have a negative effect during grief. Adolescents often fantasize about what the world would be like if they had lost someone or something significant, leading to a belief that they could have prevented the loss. Additionally, adolescents tend to grieve more than other age groups when a celebrity, idolized peer, or friend passes away. When females at this age lose their mothers, they have a high risk of developing long-term grief. Adolescents also tend to grieve more than other ages when they lose a sibling. Children, on the other hand, tend to resolve feelings of grief within the first year of their loss of something or someone they value. Also, the grieving process in the children is typically accelerated if the deceased individual was ill or in danger, just as it would for adults. We will now explore some of the models and theories that help us understand and navigate grief. It's important to keep in mind that everyone experiences grief differently, and grief is not a predictable set of stages. Firstly, there's a Kubler-Ross model consisting of 5 stages: denial, anger, bargaining, depression, and acceptance. The first stage, denial, is when an individual is confused at what is happening and could be in shock, fear, or avoidance. The next stage, anger, is when the individual may feel frustrated, anxious, or irritable. Then, bargaining is when individuals reach out to others in an attempt to create false hope for themselves by believing that they can avoid grief. Next stage, depression, where individuals may start to realize the situation and may start to feel helpless, overwhelmed, constant sadness, and worthlessness. Last stage of this model is acceptance. In this stage, it's important to know that you're not accepting, for example, that you're okay with someone dying, but instead you can accept that they have died and that you will be okay. It's in this stage of accepting that this is your new reality where you start to move on. Once an individual enters this stage, it doesn't mean that they will never have a sad day again, but rather indicates that the good outweighs the bad.
Another model of grief revolves around the idea that a person must grow around grief by Louise Tonkin. A common way of thinking is that grief will slowly go away as time goes on and eventually will no longer exist. However, this model by Tonkin demonstrates that grief will stay the same size and it's you as a person that will grow around it and become bigger.
The next theory of grief is known as the dual process model of grief by Margaret Strobe and Hank Schutz. Their model revolves around two stressors, loss orientation and restoration orientation. An individual may regularly oscillate between loss and restoration, but both require coping strategies to relieve grief. Loss-oriented coping is when the individual focuses on coping with the loss of whatever it may be. They may engage in activities such as reminiscing, yearning, crying, or imagining. On the other hand, restoration-oriented coping is when the individual grieving may start to restore their life, which can be a very challenging and stressful process. They may engage in learning new skills or taking up the tasks that the person that they have lost would do, such as cooking, arts and crafts, or puzzles.
While these are the most commonly talked about models and theories, the meaning reconstruction model and Bowlby's attachment theory are two other popular frameworks for understanding grief. Meaning reconstruction model by Robert Nopper is a very individualized concept that revolves around the idea of constructing a new sense of meaning in life, such as recreating a new sense of self. Bowlby's attachment theory, on the other hand, revolves around the idea that the bonds individuals make with significant others, typically at a young age, influence their emotional response to the loss. When breaking the bond, such as losing someone significantly valued, individuals tend to experience distress and signs of depression and anxiety.
Different resources that aid in dealing with grief, online grief counseling and therapy, local grief support groups, and insightful books and podcasts about healing through grief are just a few examples. All of the sources serve as important outlets and forms of insightful information for individuals dealing with the emotions of grief.
Additionally, traditional rituals such as funerals and ceremonies can play an important role in the healing process for individuals grieving from a death. These events bring people together and facilitate the renewal of connections with family.
Also serve as a platform for sharing cherished memories of the deceased individual, significantly helping with the grieving process. These rituals not only help individuals find comfort in shared grief, but also help them gain a deeper understanding of the meaning of life.
Thank you for listening. Please attempt this quiz to test your knowledge so that you can help yourself and others navigate grief.